We got the warning as Omicron arrived, and now it is spreading fast.
We're headed for some uncertain times, and it's going to be difficult to navigate these next few weeks.
In Oregon, new COVID cases were up 25% for the week ending December 27th. And in Washington, 6,140 new COVID cases were reported on December 24th alone, a record-setting number for a single day in this pandemic.
I think we're going to have to get very, very flexible in the weeks to come around how we think about COVID risk, especially in the light of all the services that we all depend on to live day in and day out, that we're going to expect to continue to function as this virus makes its way through.
Multnomah County Health Director Dr. Jennifer Vines believes we are in a lull between Delta illnesses and Omicron's full force. And being vaccinated and boosted is your best defense against getting very sick or dying. In fact, most of us who are in good health and vaccinated will likely manage the symptoms pretty well. The top 5 symptoms are a runny nose, headache, fatigue, sneezing, and sore throat. And yes, most of those symptoms are shared by the common cold and the flu. Getting access to COVID testing is hit and miss right now, but if you can, test. And if it's positive, follow CDC guidelines for isolating. Remember, they've changed from isolating for 10 days now to 5. If you have no symptoms, you can return to work after 5 days if you wear a mask at all times. If you develop symptoms, stay home until you feel better. Isolating at home means staying away from others regardless of vaccination status. Wear a mask while inside and ask others to do the same, preferably with a KN95, KF94, or 3-ply surgical mask. Also, ventilate your space as much as you can and reach out to close contacts and let them know they've been exposed and they should quarantine. Then, stay hydrated and use over-the-counter medications as needed. There are some stats that are good to see. COVID hospitalizations in Oregon are down 35% and deaths down 25% during the past week. Dr. Vines says in order for that to continue, people need to continue to get vaccinated and boosted, step up the masking, and for now, cut back on socializing.
All those little things that we all choose to do add up to whether or not our health systems and our essential functions make it through this wave intact.
So hang on and help out.
And just know that a lot of people are working hard to do the best we can after being handed what is a really difficult situation, especially after what is almost 2 years now of a pandemic.
Tim Gordon, KGW News.